This is CommonWell TV. Scott Adams here with you. We're at HIMSS 2017 as we go around the showroom floor to introduce some of our members here to CommonWell. And one of those celebrating a year anniversary. That's WoMBA. Here is the CEO. This is Eli Rowe. And tell us here, Eli, the primary focus of WoMBA is to collect patients' data, or at least have the patients be able to collect their own data. How do you guys see WoMBA being able to play within the interoperability scope?
That's a great question, Scott. WoMBA is really the World Medical Bank account. So it's a product, a tool, really, to help not just the patient, but to help insurance companies and to help anyone that touches medical data. Our goal is to look at all the various different data sources and be able to have them stored in one place. Verifiable data, things like that come from a hospital, a clinic, a facility, any sort of medical record, an EMR, but as well as non-verifiable data, things like Fitbit data and other data that would be able to be stored in one component place, one utilization environment, and one ability to share that data.
One massive hub, I guess we could say, right? All right, so CommonWell recently announced that it will be expanding its service offerings. Will you guys be contributing to the development of the new APIs to enhance CommonWell's interoperability services?
So at WoMBA, we're actually thrilled to be an active member and a participating member within not just CommonWell's existing services, but also to help shape their future services. We're looking way past just the actual data collection of the vendors that are there today, and we're looking from a global perspective how we can leverage so many different utilization aspects, components, and different environments, such as the health insurance ability to be able to save duplication of data, such as the emergency medicine services ability to be able to access data on the fly, such as all various different insurance and non-insurance use cases to be able to say, hey, let's take this data immediately, let's leverage the existing data that's there and share it, and let's be able to make that work.
We mentioned now a year in here to our partnership. Can you tell us a little bit about how that's gone this past year and what you've liked about being a part of the CommonWell Alliance?
Well, we think that the CommonWell leadership is fantastic. We've had really only positive experiences in so many different ways with CommonWell, its people, and its co-members as well. From our perspective, what we're looking for is to be able to say, hey, where can we not just take from CommonWell, but also bring back and deliver to CommonWell? And what we've noticed is that there's so much data that we're gathering in different areas that we feel that as a contributing member, we'll be able to bring value not just to CommonWell, but also to CommonWell's members themselves, and ultimately the patients and the insurance companies and the end users that rely on that data so much.
Here in 2017, what does the future hold between WoMBA and CommonWell?
Scott, that's a great question. We're really a patient-powered portal that our goal and our objective and our entire build is to help the patient gather their data, leverage it, and be able to utilize that data for healthcare, for reduction in cost, and for ultimately a much tighter ability to manage one's data. In 2017, we see working with Jitin and Andrew on the CommonWell side and their amazing team, as well as on our side, our CTO, Matti, who you guys know very well, and Gabor, who runs up WoMBA Europe. We see that the world becomes a tighter place in an incredibly secure environment, leveraging FHIR and all the latest and greatest from a technology and safety and security standpoint. Having that data makes it just really, really work well. So I think 2017 is going to see a deliverable that's going to bring value not just to the end consumer, but will make CommonWell a much more powerful entity. We'll leverage the data and the endpoints that interconnect through CommonWell, and we'll bring CommonWell and our ability to be able to really make that connect as one, where the whole ultimately becomes far greater than the sum of its parts, leveraging WoMBA and CommonWell.
And finally, Eli, if you had to summarize WoMBA in a couple sentences or less, how would you go ahead and explain WoMBA to the nation, to the people?
I would say what WoMBA is, as a World Medical Bank account, is ultimately the health information exchange of one. It's the ability in every language, in every country, in every format, to every EMR, a purely agnostic platform that is able to go and take down all your data to the lowest common denominator and present it instantly as your individual health information exchange of one.
Helping to get the ease of information to everybody's fingertips, as Eli Rowe here of WoMA, the CEO, as we're here at HIMSS 2017, as we continue to learn more about the partnership between CommonWell along with our other organizations.